give a bit of an explanation. CJ is a very well-established community artist. A lot of you already know that. I'm a family doctor with an expertise in care of the elderly, who's just in the process of finishing an MBA. And so we're hoping to bring together all of those, our background. And I'm very aware that healthcare needs some serious transformation. We all know what the last year has done for our elders, and that there needs to be, I mean, it's just, there's already investment starting to flow into transforming care for elders. And we think the arts has to be center to that. And one thing I've learned from working with artists is I could use my colloquial language, but I'll just say they like to change the world and to get things done. And I think that bringing artists into healthcare is not just the beautiful stuff that we're all thinking about, but it's also an opportunity to have really important people part of that transformation journey. So we're very excited about doing this. We want to inspire people to join. We want to invite people to join. And that's part of, you'll see the website was set up almost like a matchmaking site. And that was quite deliberate. We want to bring people from both worlds together. We want to really encourage research and education in the area, and we want to promote it. And I know I saw some concern about funding. That's one of the big things about this. Everybody is excited about bringing more of the arts into healthcare, but how do we fund it? And we have some ideas there. We still need funding. We have to convince arts organizations that healthcare is community and public space. We have to convince healthcare that there's actually a business case to be made for hiring artists to work in your space, because you're going to have staff that's much happier, so improved staff retention, and you're going to have patients who get better quicker and require less medication and less transfers out to acute care and have fewer injuries. So there's just, I think we have to convince on both sides in order to keep this funding going and to keep it sustainable. So I think I need another Slido question. We want to get your feedback on something, because we're bringing together two very diverse worlds. There's common arts terms and there's common healthcare terms. We use acronyms so much in healthcare. People need to cross these worlds. So we want people from your own world. Imagine somebody encountering your work for the first time. What term or acronym might they hear that you would need to explain, and enter the word or acronym? We've got to start with PSW. LTC. We use these all the time. These are healthcare, your personal support worker, your long-term care. Yes. PC does not just refer to politically correct. It's also palliative care. I want some arts terms in here too. We had a group of wise women who were our advisors, and Dr. Liz Lowen, who brings perspective from her decades. She's a nurse working as a senior leader in digital health. She's a wannabe artist. I think she's a real artist. And also she's somebody living with early onset Parkinson's, which is a degenerative neurological disorder that often requires long-term care in later stages. She asks today's audience, in a word or short phrase, what kind of culture experience would be most important to your quality of life if you were entering long-term care as a patient today? I think it's often that's most of us think, well, we won't need it or we won't go there. But just imagine you actually have to, because it does happen for people. What cultural experiences would enrich your life and be important? I love the tactile things. I think textures are really important. Singing, I have to say, when somebody comes in as a physician or as a nurse, you have to care for people who can have profound dementia and not really understand what you're doing. And you're doing something that's very invasive when you're either doing a physical exam or you're cleaning somebody. And just the bit of singing to them while you're doing that will often make a huge difference.